Good day everyone. So for today's video, we're going to discuss the first component of our BICSL, which is your hand hygiene. When we talk about hand hygiene, it is a general term in hand cleansing. Now, there are three types of our hand hygiene. Number one is we have your alcohol-based hand rub. We have your hand washing with the use of your soap and water. And the last one is we have your surgical hand scrub. Take note that alcohol-based hand rub is preferred in most clinical situations because, number one, it is more effective than soap in killing potentially deadly germs on hands. Number two, it requires less time. Number three, it is accessible than hand washing sink. And lastly, number four, it reduces bacterial counts on hands and produces less irritation and dryness than soap and water. While on the other hand washing with soap and water is mandatory in the following situations. Number one, when the hands is visibly soiled. Number two, when caring for patients known or suspected to have spore-forming pathogens such as your Clostridium difficile, then you need to do hand washing. Take note on the efficacy of hand hygiene preparation in killing microbes. As you can see, it is good to use plain soap. It is better to use antimicrobial soap, and it is best to use your alcohol-based hand rub. Now let's talk about the indications of your hand hygiene. Remember that we have your 5 moments of your hand hygiene, right? The first moment is we have your before touching the patient. So why do we need to perform hand hygiene before touching our patient? That is to protect our patients against harmful germs that is carried on our hands. So it's very important to clean your hands before touching a patient when approaching him or her. The second moment of our hand hygiene is before clean or aseptic procedure. So clean your hands immediately before performing a clean or aseptic procedure, like dressing a wound, preparing medications, giving medications, inserting cannulas, or any invasive medical procedures. You need to do hand hygiene. The third moment is we have your after body fluid exposure or risk. So if there's any task involving an exposure or risk to body fluids has ended, and after you remove your gloves, you need to clean your hands. The fourth moment is we have your after touching a patient. Why do we need to do hand hygiene after touching our patient? That is to protect yourself and the healthcare environment from harmful pathogens or germs coming from your patient or its environment. The fifth and the last moment of our hand hygiene is after touching the patient's surroundings. Why do we need to clean our hands after touching the patient's surroundings? That is to protect yourself and the healthcare environment from any harmful patient's germs. So you need to clean your hands after touching any object or furniture in the patient's immediate surroundings when leaving, even if you did not touch the patient. In order to ensure effective hand hygiene practices, you should use the appropriate hand hygiene products with appropriate technique and duration. Fingernails should be kept short. Artificial nails or nail enhancement should be avoided. Wrist and hand jewelry should be avoided as well. Then the last one, cuts and abrasions should be covered with a waterproof dressing. For the correct technique and duration of your hand washing and hand rubbing, kindly watch the next videos.